Hi, this is Dr. Bob with Carolina Value Pet Care. Thanks for joining us today. Today I have my crew of Becky, Laura, and Shelly. They're all enjoying their coffee while I'm sitting here on the other side of the camera. So Shelly's going to be asking some questions. Today's topic is going to be not coffee, but dog nutrition. So let's get into it.
Hey, Dr. Bob, what is the right food to feed my dog?
Yeah, good question, but it really depends on what stage of life your dog is, basically. If you've got a puppy, they're going to have different nutritional needs from, say, like a 5 or 7 year old adult dog, which is going to have different nutritional needs as opposed to like a geriatric dog, a senior dog, a dog that's 12, 13, 14 years of age. And we also have to consider if your dog might have some medical issues that might require them being on what we call a prescription type diet. So really depends on the lifestyle of your dog and the life stage of your dog.
What are the life stages of feeding my dog?
Yeah, so just to kind of go over them a little bit more in depth, when we deal with puppies, again, we have puppies, adults, and sort of geriatric or senior dogs. Puppies, again, everything on their whole body is all about growth and development. So they're actually going to have higher needs for protein, for muscle development, for example. More needs for vitamins and minerals because again, they've not really pretty much nutritionally depleted to many extent because they've been, of course, getting nourishment from mama while they've been developing, but now they need all this extra nutrients in order to grow and develop into adult dogs. Adult dogs, again, there's going to be a certain of recommendation for how much protein to get. And then when we get into the senior stage, again, we have to be a little bit more attentive to what type or what source of protein they're getting because we do have to be more concerned about kidney issues or liver issues as they get older. So again, that's going to be the different life stages of dogs and we want to feed accordingly.
How do I wean my puppy and get them on regular food?
So that's kind of a two-pronged question there. So a lot of people may not know the word wean, W-E-A-N, and essentially when we typically use the word weaning, we're talking about going from nursing on mama to introducing food. Now the question asked also going from weaning from a puppy to regular food. So again, that might also mean in somebody's mind going from puppy food to an adult diet. So I'll address both. So let's talk a little bit about going from nursing from mama dog and getting on to a puppy food. Quite simply, usually when they're about 4.5 weeks of age, that's when I generally like to introduce some so-called solid food, but it doesn't have to be like dry kibble. I will actually start to introduce a little bit of like, you can put some dry kibble, you can moisten it with water. Please don't use milk. Just some warm water and let it just sit for a few minutes so it'll kind of soften the food. And just put it where it's easy to reach for the little puppy. And again, about 4 to 4.5 weeks of age, that's going to be an appropriate age to start introducing the solid food. And of course, the puppy will start to learn to enjoy the solid food, and mama's going to be more inclined to kind of push the puppy towards the solid food as she starts kind of winding down the nursing period. Once we get into, as far as a puppy getting into an adult diet, quite simply, it usually depends on the breed or the size of the dog. Generally when they're about, say, 10 months of age, 11 months of age, that's going to be an appropriate time to wean them, to get them away from the puppy food onto an adult diet. And you can just transition, have a little bit of puppy food left, and then start just adding some adult food that you're going to switch them to until they get accustomed to the new diet.
Should I feed my dog on a schedule? How do I know if my dog's nutrition is suffering?
Ooh, good question. Actually, two questions there. So let's talk a little bit about the schedule. I think we all agree, we kind of humanize our pets. Nothing wrong with that, but you know, we generally have a schedule where we're eating 2 or 3 times a day. And so we think, well, gosh, my dog should be eating 2 or 3 times a day as well. So we generally put them on a schedule where they're getting some food in the morning, food in the evening, or some people will have some containers where the dog can sort of self-feed. They'll put a certain amount of food in there for the day so they can kind of graze throughout the day. There's no right answer. There's no wrong way to do it. The one issue I'm always going to be concerned about is actually the quantity. How much food are they getting during the course of a day relative to their actual current weight or their actual nutritional needs? And the other part of the question was actually,
How do I know if my dog's nutrition is suffering?
yeah, how to know if they're suffering. Probably the best way I can answer that question is if whatever you're feeding your dog you know is appropriate for your dog, great. Just keep doing what you're doing. If, however, if if your dog is very much like a what they call a SAD, standard American diet, and you're giving them Cheetos and chips and popcorn and licking the ice cream bowl and that sort of stuff, yeah, come on, please, yeah, no more of that. That's not going to be nutritionally appropriate for you, sustainably appropriate for you, but it's also certainly not going to be in the best interest of your dog. Your dog does have different protein demands that you and I don't, so we want to make sure they get more protein into their diet. So as far as getting in the appropriate type of food, again, make sure it's a dog food. Make sure that's the bulk of what they're getting. Again, I can't sit there and watch what everybody's doing. I don't care if somebody gets a little bit of table food every now and then, but the key thing is make sure you're getting the appropriate food for your dog, and it's dog food, right?
How do I know if I'm feeding my dog too much?
Just look at them. So, yeah, if you have a doubt, yeah, your dog's probably overweight. So that's probably the best way to put it. Unfortunately, just like it is with people, obesity is such a huge problem in our pets, dogs and cats. And we know it's a combination of things. It's not just a clear cut, get more exercise, eat less. Yeah, we know it's hard. We know it sounds easy, but it's not. But it's difficult to actually implement. So are they getting enough, or are they the appropriate weight? Yeah, probably the best way, you should be able to feel the ribs of your dog. You should be able to kind of feel the hips back, back in the back end. And if there's a doubt, let us know. We're always happy to give you some guidelines. We're not judging. We're actually trying to support the best quality of life for your pet. The healthier they are, the longer they're going to live with fewer problems, and the longer you're going to be able to enjoy them. That's really what the whole key is.
What are the essential nutrients my dog needs?
So essentially there are several different, and these are appropriate for dogs or cats or people. So it kind of break it down to the nutritional needs for basically every mammal. Protein, certainly for dogs, that's going to be a crucially vital ingredient. Carbohydrates, and vitamins, minerals, fat. Fat is absolutely essential. Fiber and water. That's kind of the core of all the essential nutrients that every pet, every person needs, every cat, every dog.
How will a veterinarian be able to assess if my dog is getting proper nutrition?
First, actually, that's the discussion we can have. If an owner has any questions about whether their dog is getting the appropriate diet or not, ask a veterinarian, ask us. We'll be happy to kind of hold your hand through that discussion. I know we mentioned a few minutes ago, make sure your dog's primary diet consists of dog food. Now, I don't care if it's dry kibble or canned food or even a raw diet, even if you're using a commercial raw diet or if you're trying to make your own. Although I'm always a little bit nervous about somebody who's making their own because they have a tendency to just to give to, go out to Sam's Club or the grocery store, buy whole chicken and make that their diet, which is going to be extremely nutrient deficient. A lot of protein, but it's also lacking a lot of the other essential nutrients that your pet needs.
There are so many brands of dog food. How will I know the best one for my dog?
Yeah, that gets back to life stage as much as anything else. Again, puppies, adults, and senior dogs. But I do want to make this clear. There is no best dog food out there. Really, what's going to be best is going to be the one that your dog likes. If your dog doesn't like the food, it doesn't matter how good the food is. But there is certainly going to be a difference in quality. So absolutely, this is where, again, it's easy. I understand people have some issues and financial challenges when it comes to buying food, but these are your pets. And you obviously want to give them the best quality of life, and you can do that through nutrition. So spend a little bit more, get a better quality food. There are lots of good quality foods out there, but I don't want anybody to go out there and buy, for $4 get a 50-pound dog of food. No, don't do that. Your dog deserves better than that. But again, bottom line, there is no single best food, but you also want to make sure you're tuned in to what is the life stage of your pet and you feed them appropriately for that.
When would my dog need a prescription diet?
Yeah, that's going to be a question, and a really good question, but that's going to be appropriate for your full-service veterinarian to make that decision. There's so many different prescription diets out there. They can be for urinary issues or liver issues or heart issues or skin issues and so forth and so on. There are some for, again, geriatric situations. Gosh, there's such a wide range, and that's going to be best determined from your full-service veterinarian. A lot of times it's going to be determined from blood work or combining the life stage of your pet at that time in addition to the blood work or other medical conditions that are going on. So yeah, so that's a discussion you definitely need to have with your full-service veterinarian for the prescription diets. They can make a huge amount of difference because think about it this way. Food is medicine. Food is medicine. So every single day we're making decisions that are going to affect the quality of your pet's life by what goes in their food bowl or doesn't go in their food bowl. So think about that. So anyway, so hopefully that'll give you some insights into nutrition, and we hope to see you soon. Thanks.